All right, so this is the 6th tutorial on Krok 1 2015 booklet, Krok 1 2015 booklet, and this is the last but one video in 2015. All right, so let us not waste time. Let us start right away. Electrocardiogram of a young man reveals deviation of his electrical axis of the heart to the left. This phenomenon can be caused by, what it means is that if somebody heart deviates, the axis deviates to the left, what does it mean? If it deviates to the right, what does it mean? And of course, you must know that, or it is worth knowing that the position of the electrical axis changes with changes of the position of the heart in the chest. And if the diaphragm is high, that is called, we say the person is in hyperstenic position. If the diaphragm is high, it means the person is in hyperstenic position. What it means is that the electrical axis of the heart will be more horizontal, meaning it will move to the left. It will move to the left. And if the diaphragm is low, we call such persons asthenic people. And the electrical axis is more vertical, meaning it moves to the right. So what it means is that if the electrical axis moves to the right, it is called what? Asthenic. If it's to the left, we call it what? Hyperstenic. So over here, your answer is what? Hyperstenic body type. What it also means is that the diaphragm is high. All right. A 6-year-old child suffers from delayed growth, disrupted ossification processes, decalcification of the teeth. What can be the cause? So what vitamin helps in ossification, calcification, and growth of bones? Who can tell me what vitamin are we talking about?
Vitamin D.
We're talking about vitamin D, exactly. Vitamin what? D. Vitamin D. That comes to mind. And anytime we are having low vitamin D or vitamin D deficiency, it means we are dealing with what? Rickets, or the name of the disease is called what? Rickets, where there's impaired bone mineralization and bone damage. So over here, your answer is A, vitamin D deficiency. And what is the active form of vitamin D? Who can tell me? The active form of vitamin D? Calciferol, exactly. Calciferol. Thank you. It means you have been following. That's great. A 30-year-old patient's blood test revealed the following. The blood test revealed the following. We have erythrocyte count to be 6. And you know it's supposed to be around 3 to about 4, isn't it? So to have 6, it means it's quite high. Hemoglobin is 10 millimole per liter. Vacuous disease was diagnosed. Name the leading part of the pathogenesis. Vacuous disease was diagnosed. When we say vacuous disease, it means polycythemia or primary polycythemia. Primary polycythemia. And this is characterized by an excess of red blood cells that is caused by overproduction by the bone marrow. So when the bone marrow is proliferating more, or is in hyperproduction state, what it means is that you have a lot of what? Erythrocyte in the blood smear. And that term is called primary polycythemia, also known as the vacuous disease. So over here, we're looking at what? A condition whereby there is what? Hyperproduction of the RBCs. And we talk about that, talking about proliferation, what comes to mind? Of course, neoplasm come to mind. Neoplasm come to mind. And so therefore, over here, your answer to what? Neoplastic erythroid hyperplasia. That means the red blood cells, erythroid hyperplasia. That means it is what? Proliferating more and more and more. So your answer here is B, neoplastic erythroid hyperplasia. Why? Because of vacuous disease, where there is increased production of RBCs. RBCs. A 25-year-old patient complains of increasing pain in his leg muscles occurring during walking and forcing him to make frequent stops. Skin of his legs are pale, no hair covering, toenails are with trophic changes, no pulsation of the pedal edemas, no pulsation, no pulsation. When we say no pulsation, what it means is that there's inadequate supply of blood to that artery. Inadequate supply of blood to that artery. And when there's inadequate supply of blood to those arteries, what it means is that there could be what? Numbness of the place, or there could be what? Pain at the place, because tissues are not being what? Tissues are under perfusion. They are under perfusion. You know, tissues have to be what? Perfused, but they are under perfusion. So the question now is that what is the cause of the changes being observed in this patient? Of course, because of no pulsation of the pedal arteries, what comes to mind is that there is blockage somewhere, and so therefore the cause is called what? Ischemia. Ischemia, which is caused by a blockage somewhere. So over here we are looking at what? Ischemia. Ischemia. Ischemia simply means inadequate supply of what? Of blood to tissue. Inadequate supply of blood to a tissue. Now, in venous hyperemia, it is more seen in what? In congestion. Congestion, where the liver becomes big and things like that. Portal venous pressure is increased. That is called what? Venous hyperemia. Now, in arterial hyperemia, it talks mainly about, for example, due to any source of inflammation, blood will move to that source of what? Inflammation, and the place becomes very, very what? Hot, because blood is moving with a high speed to that place of what? That place where the cell is damaged, and that is called arterial hyperemia. Now, an embolism is simply a clot or a foreign body in moving inside the blood vessel. That is what? Embolism. But over here, there is no pulsation. And the fact that there's no pulsation means that there is what? Ischemia. So your answer here is E. Now, this year, influenza epidemic is characterized by the patient's body temperature varying between 36.9 to 37.9. Such fever is called 36.9 to 37.9. What is the name of such fever? So this brings me to the normal types of fever. The different types of fever. So for a normal fever, the range of temperature is between what? 36.5 to 36.8. That is for a normal fever. 36.5 to 36.8. For a subfebrile fever, or for fever that is classified as subfebrile, we have temperature to be between 36.9 to 37.9. 36.9 to 37.9. In a febrile fever or temperature is 38 to 38.9. 38 to 38.9 degrees Celsius, of course. Then in pyretic means 39 to 40.1 degrees Celsius. 39 to 40.9 degrees Celsius. And when you have temperature to be above 41 degrees Celsius, we term it as hyperpyretic. Hyperpyretic. So I've differentiated between all the different types of what? Of temperature. So over here, 36.9 to 37.9. What comes to mind? What type of fever is it? Quick. Oh.
Subfebrile.
So this is exactly subfebrile. So your answer here is E, subfebrile. subfebrile. A woman complains of visual impairment. Visual examination revealed obesity in the patient, and her fasting blood glucose level is hyperemic. So that means that there is too much glucose in the person. For that region, it is causing what? The eye areas love this sort of what? Glucose. So when this glucose gets deposited over those areas, it can cause what? Visual impairment. So the question is, what diabetic complication can cause visual impairment or blindness? Visual impairment or blindness. So basically over here, you are looking at for what? For any sense of what? Retinopathy. And usually it is caused by macroangiopathy. Microangiopathy, which is a chronic complication of diabetes mellitus, which affect the small blood vessels. It affects the small blood vessels, and this manifests as retinopathy, that is visual impairment, nephropathy, and neuropathy. So we can have a neuropathy, we can have nephropathy, and we can have retinopathy. So that is one of the complications of too much of sugar in your system. So your kidney could be affected, your nephrons could be affected, and your eyes could be what? Affected. That is why we always make sure that people with diabetes are well treated, because it can cause a lot of complications. Why? Because this glucose gets to lodge inside these micro vessels or these small vessels in the body. So here your answer is A, microangiopathy. That means disease of the blood vessels. Prolonged treatment of hypothyroidism. Prolonged treatment. That means this person was having there's a prolonged treatment of hypothyroidism. That means there was low thyroxine. And of course, if you have low thyroxine, what do you give? We've discussed this in, in pharmacology. So low thyroxine, what do you give? Who can tell me? Low thyroxine, what do you give? You give what? Yes, you give levothyroxine or L-thyroxine, as simple as that. So over here, the prolonged treatment has caused dystrophy, dental caries, tachycardia, tremors, and these are all signs of what? Hyperthyroidism. Hyperthyroidism. That means that they've given too much of the thyroxine hormone. Now we are having hyperthyroidism. A 3-year-old child has eaten some strawberries. Soon he developed rash and aging. Rash and aging. What was found in the child's leukogram? What was found in the child's leukogram? So over here, rash and aging. Who can tell me what it is? I mean, what type of hypertensivity is it? Rash and aging. What comes to mind? Come again?
First hypertension.
Yes, so type 1 could come to your mind. And in type 1, we talked about what? Eosinophils. We talked about what? Mast cells. Because when these mast cells granulate or degranulate, that's when they release the histamines and all those kind of things. And the people suffering from this kind of allergic kind of reaction, there's always increased amount of what? Eosinophils. So there'll be what? Eosinophilia. And that's what over here, your answer is A. Eosinophilia. So if you check the blood, you will see eosinophils present. Don't forget, you cannot find mast cells in blood. Mast cells are found in tissues. So don't confuse yourself. So here, your answer is what? Is A. A patient has been found to have a marked dilatation of the saphenous veins in the region of the anterior abdominal wall around the navel. This is symptomatic of pressure increase in the following vessels. So, of course, talking about marked dilatation of the saphenous, that is more or less like the deep veins of the anterior abdominal wall of the navel. It led to what? A pressure increase. So when there is, so the question now is that what sort of hypertension can occur in the abdomen? That's basically it. What sort of hypertension can occur in the abdomen? Who can tell me what sort of pressure can occur in the abdomen? That pressure, we call it what? Portal hypertension. Increased pressure in the abdomen or around the abdominal area, we call it what? Portal hypertension. Why? Because we are thinking of the what? The portal veins. And that's why over here, your answer will be what? The portal vein of the liver. The portal vein of the liver. So these places will become what? Hypertensive. They'll become what? Dilated. So your answer here is D. Venous portal hepatitis. All right. So before I read the question, low density lipoprotein and high density lipoprotein. Which one is the good cholesterol? Which one is the bad cholesterol?
High density is the good. Low density is the bad.
Wonderful. So now we've been able to understand that the low density is the bad guy, whilst the high density is the good guy. Now, who can tell me the function of low density and the function of high density? Anyone? Not the person who just said it. Another person.
I think high density takes away cholesterol.
High density takes away cholesterol. Good. And low density do what? So you are correct. Good.
Builds up cholesterol.
Where? It builds up cholesterol. Good. So what it means is that low density lipoprotein sends too much cholesterol to the tissues. This could be the vessels. This could be any tissue. So it sends cholesterol to the tissues, whilst high density lipoprotein takes the cholesterol from the tissues to the liver. So please take note of these two things. Great. Now let's come back to our question. So now what do we have? We say that a cholesterol content in the blood serum of a 12-year-old boy is 25. Analysis states that hereditary familial hypercholesterolemia caused by synthesis disruption of receptor-related proteins. So what it means is that which one of these, either high or low, is responsible for causing too much of cholesterol in the people. For that reason, it even has become what? A hereditary kind of a problem. So what comes to your mind? What comes to the mind is low density lipoprotein. Exactly. So you are 100% correct. Low density lipoprotein. So over here, we're having what? C to be our answer. C to be our answer. All right. Obesity is a common disease. We all know that. The aim of its treatment is to lower the content of the neutral fat in the body. What hormone-sensitive enzyme is the most important intracellular lipoprotein? Intracellular lipoprotein. Ladies and gentlemen, who can remember cyclic AMP? Did I talk about cyclic AMP over here? Did I talk about cyclic AMP over here?
Yes, sir.
Yes, and we said cyclic AMP is a second what? Messenger, or a secondary what? Messenger. Isn't it? Now, the primary, guys, is what? The enzyme that will cause the activation of this cyclic AMP, for which fat will be what? broken down. And if you can remember very well, we said that we are dealing with what? Lipase. And talking about lipase, we are talking about what? Triacylglycerol lipase. And mostly it's actually called phospholipid lipase, something like that. That is the actual sort of enzyme we need to what looking out for. But of course, over here, the hormone sensitive lipase is what? The triacylglycerol lipase. And this will go and then activate the cyclic AMP. This cyclic AMP will start breaking down what? Fat tissues, start breaking them down, and will convert them to what? Energy production. And again, if you can remember very well about carnitine, you guys can remember, can remember this very well because I'm sure he said something about carnitine. So this carnitine, so what happens is that when cyclic AMP becomes activated and start breaking down all these fat tissues, converting them into energy, they undergo, or their energy production is through a process called beta oxidation. When you begin to do proper pathophysiology, you understand beta oxidation. So in beta oxidation, what happens is that carnitine will carry out these fatty acids and take them to the mitochondria, and of course, for energy production to be made. Guys, let me not just bore you with too much biochemistry and pathophysiology, because personally, I love these kind of things. Okay, but I believe you understand what I'm talking about. So over here, your answer is what? Is D. Your answer is D. A 40-year-old man was diagnosed with glomerulonephritis. That means that there's a problem in the kidney, isn't it? Glomerulonephritis, problem with the kidney. And it is based on her clinical symptoms and the result of the urine analysis. Analysis states that there was a chronic tonsillitis. Who can tell me the causative agent for tonsillitis? Streptococcus. Fantastic. Streptococcus. That is the causative agent for what? For tonsillitis. And actually, so the actual disease here is called what? Post-streptococcal glomerular nephritis. Post-streptococcal glomerular nephritis. And it comes about when there is inadequate treatment or improper treatment of tonsillitis. And the immune complex will start building up. Don't forget, this is type 3, isn't it? So this is type 3 hypersensitivity reaction. Am I right? Am I right, guys? Anyways, we talk about this, so I believe you guys should just take your time and go through the video. We have type 1, type 2, type 3, type 4. So where there's immune complex formation because of the tonsillitis, these immune complexes start getting attached onto the tissues or onto the glomerulus of the body or the glomerulus of the nephron. And when you get attached to it, the body now begins to look at it and like, hey, where are you from? We don't know you. And begins to attack it. And that's the development of what we call the post-streptococcal glomerulonephritis. So over here, your answer is what? Streptococcal glomerulonephritis. Sorry, streptococcus. So the answer is B, streptococci. That's the plural form. All right. A man is suffering from diarrhea. In the summer, he spent his vacation in the south at the east coast. Bacteria with the following properties were detected in his feces: gram-negative curved mobile monotrichous bacilli that do not produce spores or capsules. They are undemanding to nutrient medium, but require alkaline reaction. Who can remember alkaline peptone? Who can remember? What do we say about alkaline peptone?
Cholera.
Exactly. That is the medium for cholera. That is the medium for cholera test. So even if you don't remember all of this, blah, 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 just remember the alkaline reaction. So the fluid is called the medium is called the alkaline peptone. Alkaline peptone. So and of course, the causative agent is what? The vibro cholera. The vibro or the organism is called what? Vibro cholera. Vibro cholera. And this is gram-negative, comma-shaped. It is comma-shaped. Comma-shaped. All right. So over here, we are looking at what? At cholera as our answer. Cholera as our answer. In some question, they will say rice water stew. When they say rice water stew, you already know your answer to what? To be cholera. Sorry, guys. You know your answer to what? To be cholera. All right. A patient is diagnosed with chronic atrophic gastritis. Guys, how many types of gastritis do we have? Who can tell me? Types of gastritis. Anyone? Okay. We talked about the types of gastritis. I don't know if it is here or it's in Krok 2, but I remember I spoke about types of gastritis. We have type A, type B, and type C. I repeat, we have type A, type B, and type C. So my assignment is go and look for what is type A, type B, type C. Which one of them is responsible for causing the peptic ulcer that you know? Go and look for it. Type A, type B, type C. So it's an assignment for all of you. All right? Type A, type B, type C. Some are acute, some are chronic. And in which case do we find H. pylori to be present? But that's not the question. The question now here is what? There is a deficiency of the castor's intrinsic factor. What is the function of intrinsic factor? Some of you talked about it the last time. So who can tell me the function of intrinsic factor is for what?
Absorption of vitamin B.
Vitamin what?
B.
Please be specific. Not just vitamin B. Vitamin B12. Please. Vitamin B12. Don't forget there are a lot of vitamin Bs. So if you say vitamin B, you've said nothing. All right? So vitamin what? B12 is absorbed or is able to be absorbed when we have the intrinsic what factors. So an absence or the absence of intrinsic factors means that there will be inadequate intrinsic factor present, and so therefore vitamin B12 will not be what? Absorbed. And if vitamin B12 is not absorbed, what it means that we are going to have what? Vitamin B12 deficiency anemia. Vitamin B12 deficiency anemia. What will be the size of the cells? Who can tell me? Megaloblastic. So macrocytic, exactly. Macrocytic, megaloblastic, exactly. All right. I like the fact that you people have been following all the nonsense I've been talking about over here. Anyways, let's continue. All right. Now, a pregnant woman was detected with IgM to rubella virus. Guys, what did I say about IgM? Who can tell me? That when there's too much of IgM, what does it mean?
You said that when there's an infection in the body, because IgM is a lot, it detects it the first. It's able to detect it first.
Wonderful.
So if anybody gets an infection, IgM is able to.
So anytime we are having any sort of what acute problem, acute infection, acute problem, IgM comes in. Like I said, how I remember is that M means most, isn't it? So they will come. So they will be the first to come to the place of what infection before the the other ones will start what coming in. Great. So now we have what IgM to rubella. An obstetrician gynecologist recommended therapeutic abortion due to high risk of teratogenic affection of the fetus. Of course, people with rubella and they're pregnant will terminate pregnancy. Now, detection of IgM was of great importance as it is these specific immunoglobulins that, of course, indicate that there is what? A recent infection, or there's what? An acute infection present. Acute infection present. And over here, your answer is what? A C. Indicate recent infection. Indicate recent infection. Now, if there is a secondary infection, what will come is what? IgG. So take note. Secondary IgG will come. Primary, it is what? IgM. Great. A patient is diagnosed with cardiac infarction. Cardiac infarction. What does it mean by cardiac infarction? Who can tell me? What does it mean by cardiac infarction? We are revising. No, we've done everything, but we're just revising. So what does the meaning of cardiac infarction? Who can tell me? I've talked about infarction. What does it mean? Oh, anyone?
Like maybe inadequate blood supply to the affected area.
Wonderful. Wonderful. Next time, do you the word maybe. Just say inadequate supply of blood to the tissue. And this one, the tissue of the heart. To be specific, the muscles. Okay? The muscles. To be specific, the muscles. Another name for cardiac infarction is what? MI, myocardial infarction. That's the same thing. Myocardial what? Infarction. Now, blood test for cardio-specific enzyme activity was performed. Which of the enzyme has three isoforms? Which of the following enzymes has three isoforms? Guys, who can remember a question we solved on muscle dystrophy? And what do we talk about muscle dystrophy? What enzyme is very, very common in muscle dystrophy? We said in muscle dystrophy, what comes to mind is what? Is creatine kinase. Creatine kinase. These, anything that's muscle destruction, muscle dystrophy, we even talk about Duchenne. We talk about Duchenne. So we talk about all of these things. So please don't forget them. So over here, we're looking at what? Creatine phosphokinase, also known as creatine kinase. Creatine kinase, or CK, or CPK. CPK. They are all mean what? The same thing. And these enzymes are found in the heart, the brain, the skeletal muscles, and things like that. And mostly when there's what? Muscle dystrophy. Muscle dystrophy. You will find them there. You will find them there. So over here, we're looking at what? Of course, you can also see LDH and things like that also over there. LDH. You can find them like that. I mean, there. But over here, your answer should be what? Should be creatinine what? Kinase. What other marker can you find in the heart? We call it what? Troponin. Troponin. This is just some information. Troponin. Troponin. Another marker that you can find in the heart for any infection or for any problem going on is what? Troponin. Maybe Krok doesn't want you guys to know this. So the answer is E. A 50-year-old man who has been suffering from chronic hepatic failure for several years has developed ascites. What is the main mechanism of this disorder development? What is the main mechanism? Guys, can you remember we spoke something a while ago about dilatation of deep veins? Who can tell me? Do you remember? Just a few minutes ago. Oh, so the mechanism of the ascites development is what? Increased pressure in the portal venous system. Don't forget I mentioned about the portal hypertension. Don't forget it. Because there's dilatation of these vessels. And that is leading to what? The too much pressure, too much fluid overload over there. So the mechanism of action is because what? There's increased pressure in the portal vein or the venous what? System. Don't forget there is what? A problem with the what? The liver. So please don't forget that. Don't forget that. And I talk about congestion and things like that. All of these things talk about pressure in the portal venous. That's if you understand the concept, it's easier for you to always make something out of it. Okay. Of course, if there's a problem with the liver, definitely albumins, globulins, they'll all be affected. But over here, the mechanism for the ascites development is because of what? Portal hypertension. Portal hypertension. A 30-year-old man has sustained an injury to his thorax in a traffic incident, which caused disruption of his external respiration. External respiration. What type of ventilatory difficulty can be observed in the given case? So we're having a problem with his external respiration. External respiration. What does it mean to have a problem with what? External respiration. What it means is that you are not able, or the person is not able to breathe in air. To take air from outside into the system. It's not able to take in what? Air. So the question is, why are we having such a problem? This is because we are having a condition called restrictive extrapulmonary, means outside the lungs. Extrapulmonary means what? Outside the lungs. Restrictive extrapulmonary ventilatory impairment. I repeat, restrictive extrapulmonary, because this is occurring because of the trauma from the road traffic accident. So whatever it is external, it is not internal. It is external and not what? Internal. So that is what is causing what? The restriction. So that's a restrictive extrapulmonary ventilatory what? Impairment. Now don't go in for what? For pulmonary ventilation. No, this is not a lung problem. It is rather the outside the lung, outside the lung problem. Now, in obstruction is when you are breathing out. In obstruction, when you are breathing out. Example, asthma. People suffering from asthma are having what we call obstructive problem. Obstructive, because something is blocking. Obstructive, something is blocking the air from going out. So there are two differences. Don't mix the two up. So your answer here is A. A 53-year-old man suffering from diabetes mellitus has developed a painful conical induration, bluish red with yellow at the center on the skin of his neck. What changes is this typical of? What changes is this typical of? One thing that you must know is that people suffering from diabetes mellitus, they normally develop what we call boil. They can develop a lot of what? Boil. Now, a single boil is called what? A furuncle. Too many boils or multiple boils is called what? A carbuncle. So now over here, we are having what? A furuncle, because there's no multiple boils present. Because they said there's a painful. A painful means one painful conical induration. That is one thing. It is bluish red with yellow center. This is just a boil due to diabetes. And that boil, single boil, is called what? A furuncle. Plenty is called what? A carbuncle. So over here, we're having what? A furuncle. So your answer is C. Biochemical analysis of an infant erythrocyte revealed evidence of glutathione peroxidase deficiency and low concentration of reduced glutathione. What pathological condition can develop in this patient? What pathological condition can develop in this patient? So one thing you must understand when it comes to glutathione and glutathione peroxidases is that they prevent oxidative reaction. When we talk about oxidative reaction, we are referring to what? To the red blood cells. We are referring to the red blood cells. Red blood cells. Red blood cells. So over here, we have the red blood cells. So if there is low concentration of these glutathione peroxidases, as a result, there is low reduced glutathione. What it means is that the body cannot protect itself against oxidative reaction. Against oxidative reaction. So that means red blood cells will be broken down. Red blood cells will be broken down. And so therefore, we are going to have a case of hemolytic anemia. By now, you should know what pernicious anemia is. Vitamin what? Megaloblastic, you should know. Sickle, you should know. Iron deficiency, you should know. But over here, we are dealing with what? Hemolytic anemia due to low glutathione. Low glutathione. In winter, a 3-year-old child has sharp rise of body temperature. Hemorrhagic rash is observed. Bean-shaped gram-negative microorganisms situated in pairs are detected in the blood. What provisional diagnosis can be made? What provisional diagnosis can be made? Guys, don't confuse the bean-shaped gram-negative impaired with gonorrhea. This is a small child, 3-year-old baby. So don't want to tell me this is gonorrhea. And gonorrhea hardly comes with this hemorrhagic kind of what? Rash. So please take note of that. Kindly take note of that. So over here, of course, your differential could be what? Gonorrhea and meningococcus. These are your differentials, gonorrhea and meningococcus. But again, you look at the presenting complaint to make a definite diagnosis. So over here, we are having what? Meningococcus as our what? Diagnosis. And this child is just a matter of time. This child could develop what we call meningitis. This child could develop meningitis. All right, so over here, we are having the answer to be D, meningococcus. Meningococcus. So the answer is D rather than B, child. Hemorrhagic rash. Take note. Microelectrode analysis of nerve fiber bioelectrical activity revealed that the membrane potential is equal to 90 millivolts. Its initial resting potential was 85. What process occurs in this case? So its resting membrane potential is 85, but it has now short. It has now moved to what? To 90. So what process occurs in this case? And of course, we are having a case of what? Hyperpolarization. The more positive the thing is becoming, that means the more over-resting, or the more, how do I even put it? Basically, it's over-resting, because this is talking about perhaps the T wave. This is talking about the T wave, where we have what? What am I talking about, Seth? Please let me just get my mind right. I'm getting confused over here with T wave. Please, who can tell me? So hyperpolarization is when you are entering to what? Your resting potential, isn't it? Now it has increased from 85 to 90. That means that there is too much there is too much. So the initial resting potential or the rest potential was 85. Now we're having 90. What it means is that there is either an efflux of potassium chloride or influx of chloride ions. And hence we are having what? Hyperpolarization. That means it's over resting. So that means you need more force to kick the guy up to undergo what? Depolarization. To undergo what? Depolarization. So over here, we are looking at what? Hyperpolarization. Hyperpolarization. So your answer here is D. Your answer here is D. All right. Parkinson's disease. Parkinson's disease is caused by disruption of dopamine synthesis. What brain structure synthesizes the neurotransmitter? And of course, we're talking about what? The substantia nigra. The substantia nigra, from where we have niger, substantia nigra. So people with a problem or loss or a problem in the substantia nigra, they develop, this is found in the midbrain actually. So they develop what we call what? The Parkinson's disease, where their muscles begin to be shaking like that and things like that. And I think Muhammad Ali, the popular boxer, developed this kind of disease before he died. So over here, we're looking at what? Parkinson's disease. Sorry, substantia nigra. Substantia nigra. Determine a patient's blood group with monoclonal test reagents revealed a positive agglutination. That means there is reaction. There's a positive agglutination to anti-A and anti-B, and negative to anti-D. What blood group does this patient have? Now, if you put the blood group into A, there is reaction. If you put the same blood group into B, there is reaction. Ladies and gentlemen, what comes to your mind? Who can tell me?
AB negative.
Blood group what?
AB.
AB.
Blood group AB. Exactly. Blood group AB. These people don't want to give to anybody. They don't want to give to anybody. So they give to A, problem. B, problem. That is it. So you are absolutely correct. Now, anti-D simply means what? Rhesus factor is negative. So it means rhesus factor. Anti-rhesus factor. Anti-rhesus factor. Factor D, meaning anti-rhesus what? Factor. So basically, that's what it means. So over here, we are having what? Now, so they say there's negative reaction to this. So what it means is that since there's a negative reaction, it means that there's not even rhesus present. There's not even what? Rhesus present, because it's negative. So that means if it were to be positive, then it will react, and then what? It will give what? A negative, to be positive to anti-D. Do you understand me, guys? So over here, we are having what? Blood group AB with rhesus negative. Rhesus negative. Rhesus negative. So you hear your answer is E. Rhesus negative. Rhesus negative. All right. And don't forget, anti-D is always given to people with rhesus negative. Don't forget that. Anti-D is given to people with rhesus negative. And it says rhesus is negative. So don't get confused. A patient visited a dentist to extract a tooth. After the tooth had been extracted, bleeding from the tooth socket continued for 15 minutes. Analysis says that the patient suffers from active chronic hepatitis. What phenomenon can extend the time of hemorrhage? What phenomenon can extend the type of hemorrhage? Don't forget, so over here, we are going to look at what? Coagulation was problem or clotting problem, isn't it? And they didn't bring hepatitis there for nothing. Don't forget, many of the clotting factors are produced from the liver. Many of the clotting factors are produced from the liver. And they said, the question said that what phenomenon can extend the time of hemorrhage? What it means that what clotting factor, if absent, can increase the time for clotting to happen. And of course, you are thinking of factor 1. Factor 1. And factor 1, we're referring to what? Fibrinogen. Fibrinogen. So when there's a decreased fibrinogen content in the blood, what it means is that it will take a longer time for hemorrhage to cease or for bleeding to cease. So to give it too much time, there'll be too much what? Time for bleeding. And I hope you have understood it. Again, they didn't write the hepatitis there for nothing. They wrote it for you to know that indeed we are talking about what? Fibrinogen. Fibrinogen. So here, your answer is what? Is B. Decrease of fibrinogen due to the acute chronic hepatitis. Name the halogen-containing antiseptic with fungicidal properties, which is used to treat dermatomycosis. Used to treat dermatomycosis. And of course, thinking of, when you say halogen substances, I'm talking about halogen or halogen-containing substances. We're referring to what? Either chlorine, these are halogens. Chlorine, first you start with what? Fluorine. First, start with fluorine, chlorine, iodine, and so on and so forth. These are people in the halogen groups. In other words, their outer shell has 7 electrons. 7 electrons. Even me, I can remember my chemistry. 7 what? Electrons. So over here, you are looking at how do you call it? An antiseptic, either with fluorine, either with chlorine, either with what? Iodine. So of course, over here, your answer would be what? Would be what? Iodine solution. Iodine. If you do this way, you can easily get your answer correct without any struggling in the brain. All right. So your answer is what? Iodine solution. Due to severe pain syndrome, a patient was prescribed with a narcotic analgesic. Name this drug. Don't forget, there's a severe pain syndrome. Severe pain syndrome. So definitely you are going to be looking out for what? For morphine. Morphine. You look out for morphine. Morphine. One of the highest narcotic analgesics. So the answer is C. And I know if I should ask you now, intoxication of morphine, some of you already know it. Now, during pathomorphological kidney investigation of a patient who for a long time had been suffering from osteomyelitis, that means disease of the bone, and died from renal failure, that means kidney problem, there was deposit of hematogenous eosinophilic masses in the glomerular mesangium. That means there are some substances that are eosinophilic in nature. In other words, they are more or less like a pink in nature. Pink in nature. Good. So they are found in the artery, the arterial walls, the stroma, which became red when stained with Congo red. And this brings us to the accumulation of what we call some proteinous substances called amyloids. Amyloid, these are like proteins. These are proteins. So because of their proteins, they become red when stained with Congo red. And that's over here. Your answer will be what? Amyloidosis, where there is what? Increased accumulation or deposition of amyloids. But of course, this is secondary amyloidosis. Why? Because already this person was suffering from what? Osteomyelitis. So this was secondary amyloidosis. So your answer is C. A microslide presents a tissue with a spherical cells, each of them containing a large fat drop covered with thin cytoplasm in a center. Nucleus is compressed and situated at the cell periphery. What tissue is it? So they've told us what? Fat drops. So first of all, you must understand that there are two types of adipose tissue. Of course, fat don't mean that there's what? Adipose tissue. But there are two types of adipose tissue. We have the white. One, we have the white, and then we have the brown. Now, the white, it is more found in adult. The white is more found in adult, and it is usually what? Unilocular. Then we have the brown, which is multilocular, which is found more during the fetal life. So we have white, we have brown. Brown in children or in the fetal life, and the white one is found in adult. So definitely over here, we are going to be looking at what? So we're looking at a tissue of an adult. Why? Because the nucleus are always small and they go to the edges of the cell. So this is one of the small differences between the white and the brown. Now with the brown, they'll be more central. All right. So over here, we're looking at what? White adipose tissue. To treat rheumatoid arthritis, a 65-year-old woman was prescribed immunosuppressant. Please, guys, this question is for you guys. Who can tell me the answer? Immune suppressant. The answer is what? Prednisolone. Exactly. So your answer is what? Is D.